Welcome to Science, Health and Healing Encyclopedia of Children's Health Core and Ali Academy. I'm Dr. Majid Ali. The subject of this article is Autism Cured in 1 in 4, Part 5. I'm going to strongly suggest that if you happen to have fallen upon this video, please look at the entire series. The points that I'm raising are very important. In June of 2012, the Journal of Autism and Developmental Disorders published a paper where they showed that 111 children who were diagnosed with autism spectrum, when the proposed new changes in DSM-5, their Bible of diagnosis of mental disorders, were used, 26 of these children were diagnosed not to have autism. In other words, they decide what criteria they use to give you the diagnostic label, which has such serious consequences. In some other segments of this series, I challenge the very qualifications of those psychologists and psychiatrists who think they're experts of autism and who establish these diagnostic criteria. Unless they can demonstrate proficiency and certification in clinical nutrition, clinical ecology, and a deep understanding of the neuroenergetics, the ATP energy generation, and the toxicities that block ATP generation in brain cells, they're not qualified to make any statements about this. What should the children, the parents, and the teachers do? I think the first thing they should do is what I'm hoping that this series will do: challenge their qualifications, psychologists and psychiatrists. Accept that autism is a problem of toxicities of neurodevelopment. It's not a psychological problem. Refuse to take the diagnostic labels by these professionals. You know, I realize that sometimes to get your child entitled for some educational programs, that you need a label. Until such time that more and more people realize that autism spectrum is not a psychological disease or a psychiatric disease, here's what I suggest. Reject in your heart and in the core of your spirit those diagnostic labels, because they are based on arbitrary things. The wind blows to the west and psychologists and psychiatrists say, well, 111 children have autism, and if the wind blows to the north, they all of a sudden change and they say, hey, 24.3% of these children, 26 out of 111, have autism no more. This is the reality. I would rather, as a parent or as a teacher, as a professional, you learn to focus on issues of nutrition, environment, food allergy, mold toxin, buildup of toxic stuff in the brain of the baby coming from the mercury fillings in the mouth of the mother. So there are simple, easy ways. In a series entitled The Oxygen Model of Autism, on this encyclopedia, I give you detailed information about how to address these. My short core message in this series for you is that pay lip service to what psychologists and psychiatrists are telling you unless you know. Ask them a simple question. How many children with autism have you seen dramatic improvement by focusing on issues of nutrition, gut ecology, bowel ecology, liver ecology? How much experience have you had in dramatically improving the mental functions and the neurodevelopment of these children by focusing on food allergy, mold allergy, toxic metals? How much do you really know that you can take a urine sample of these children, send it over to the laboratory, get a profile of 60 organic acid, which will clearly tell you in a quantifiable way, in a reproducible way, in an objective way, how much of the mold toxins like furan compounds, tartaric acid, arachidonics, they are directly interfering with the proper brain development of your child. And if they talk about their psychological theories and psychiatric theories, walk away. It's really that simple. I do not go to shoe stores to buy flowers. And I suggest that you also do not go to a shoe store to buy flowers, which of course you don't. But I think you do see my point. So this is part 5 of the series, Autism Cured 1 and 4. Please look at all 6 segments in this series. Please look at all 9 segments on the series of the oxygen model of autism. I hope that this information will allow you to make intelligent, informed decisions about the health and the development of your child. Thank you for joining me. You can support our vision at Children's Health Corps by forwarding this YouTube segment to your contacts. Visit our website www.kids123.org. Tell us how you can participate in this effort. Thank you. Thank you so much.